Hello, I'm Dr. Lola Ashaye, and you're listening to Connecting the Dots with Dr. Ashaye. So, this month we've been talking about prediabetes and diabetes, and we've discussed lifestyle changes to lower blood sugar naturally. But the truth is, for many people with high blood sugar, medications may need to be taken into consideration. But I know when I've talked to a lot of people, they prefer not to take medication, some because they just don't like taking them, others because they're genuinely concerned about potential long-term negative side effects from them. And today I'm going to discuss one of the most common medications used for treatment of diabetes and some of the concerns around it. So again, you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land, which is in the Houston area in Texas. And here we help you more easily become and remain healthy with direct access to a doctor so you can live fully and enjoy doing what you love. So we're perfect for business owners, international visitors, and for those that may have a high deductible or even those that don't have health insurance, our services are perfect for you. Okay, so as I mentioned, one of the most common diabetes medications is, and I'm sure you guessed it, metformin. And I've had patients that are on metformin, their blood sugars are well controlled, and then one day they just stop taking it. And it may be because they read something somewhere. I've had patients that maybe got a WhatsApp post about a potential long-term side effects of their, on their liver or their kidney, or maybe they heard a story or they know someone that had a negative side effect from metformin, so they got scared and they stopped taking the medication. So let's dig a little bit deeper about this medicine, metformin. So metformin has been around for a while. It's said to be discovered in 1918, and then it was studied in humans in the 1940s and 1950s. First used in Europe in about 1957, and then it got FDA approved in the US in 1995. So it's been around in the US at least for about 30 years and, longer in Europe. And about 150 million people worldwide take it. So it's a very, very common medication. So obviously, because it's common, the more people that use the medication, the more you're going to hear about it. So first, why is it used so commonly? Well, one of the biggest reasons is when we treat diabetes or prediabetes, which means your blood sugar is too high, one of the concerns at the back of your doctor's mind is, are we going to give you too much medicine to make your blood sugar too low? And that's called hypoglycemia. So that's always in the back of our minds when we're giving you medicine, because hypoglycemia can be very dangerous. It can actually be deadly. And so we want to make sure that whatever medicine we're giving you is safe and doesn't cause your blood sugar to go so low that it causes a very, serious complication or even death. So one of the major advantages of metformin is it does not increase that risk of low blood sugar, like many of the other blood sugar medications. So it's one of those medicines that, you can prescribe safely to a lot of people because you're not so worried about the blood sugar going too low like you are in other medications for diabetes or prediabetes. Another advantage of it is it doesn't lead to weight gain. And many of the medications that lower glucose, one of the potential side effects is weight gain. And metformin is one of the ones that does not increase the risk of weight gain. And it actually helps some people shed some weight. So it has that advantage as well. Another major advantage is that it can help with heart health. So research is showing that it does not just lower the risk of heart disease, but it actually lowers the risk of death related to heart disease, which is huge, right? So metformin can also delay the onset of diabetes for people that have prediabetes. So as you can tell, there are many advantages of it, excuse me. And so that's why a lot of people, a lot of doctors will prescribe it first because it's easy to take, it's cheap. It's been around for a long time now. So there are many reasons why that's the first choice for people with diabetes or prediabetes. But despite its benefits, many are worried about taking it. And there's been some stuff on social media of all kinds of potential negative long-term effects of it. And as I've mentioned earlier, some people just stopped it. They read something and they stopped it. I've also had patients that have refused to start it in the first place. Maybe their A1C is still low enough where, that's a good option. But because they are concerned about it, they decide, no, I don't want to take it. And the thing about it is I've also seen where, people refuse to start medication early, and then several years down the line, now they have to take medications because now they have symptoms, they're feeling it, they have developed organ damage, and now they have to take even more medication. Now we're talking not just metformin, but metformin plus 3 or 4 other things to keep their blood sugar controlled. So that's a big reason why, I wanted to just share some things that, to help people make good decisions and consider when making decisions about taking medication, especially medication like metformin. So yes, metformin can have side effects like every other medication, and it is not for everyone. It's a medication, it's prescribed, which means that it should be monitored by a doctor. And the most common side effect of metformin are abdominal side effects. So I think that is also why, the misinformation online get people scared because, many of the things that I see or hear, I've heard my patients tell me is concern about it affecting their kidney or their liver, without understanding the context. And the thing about it is metformin, one of the most common side effects from it is diarrhea. It can also cause bloating and gas and maybe abdominal discomfort. And those symptoms are affecting the abdomen. And, all of us know that the kidneys and the liver are in our abdomen. And I think people start thinking, oh, maybe that's what's causing my discomfort. Maybe it's, the metformin affecting my liver or the metformin affecting my kidney. And so they stop it because they're concerned that, it's actually causing problems and they can feel the problem happening. But the thing about it is actually that metformin, even if it does affect your abdomen, most of the time, symptoms like diarrhea, bloating, and gas are from the intestine, not from organs. Many people that have liver or kidney disease will not have symptoms like that. And even when they do have symptoms, the symptoms are much later in the progression of their condition. So anytime you're taking medication, including metformin, you know, if it's going to cause problems to your organs, it's important. It's important. You wouldn't, the symptoms are usually not what will tell you that. It's usually, your doctor will let you know when they're checking your labs and monitoring your symptoms and things like that. And like I said, most people can take it safely, but it needs to be taken with a doctor's supervision. And most people need to see their doctor at least 2 to 4 times a year to make sure that they're stable while taking the medication and make sure that it's not affecting them negatively. And yes, metformin, the dose may need to be adjusted or it may need to be stopped in some people. It may need to be stopped because they're not tolerating it well. Most of the time, when you start taking it, it's possible to take it very slowly and the body often gets used to it. But some people, cannot tolerate it. Some people have, conditions that make it risky for them to take because they can build up lactic acid, which can cause problems, if they're taking metformin. So again, the bottom line is many people can take it safely. The discussion needs to be had with your doctor. And when it's prescribed safely with the doctor, a lot of times there isn't an issue with it. So what if there's something else I haven't mentioned, like a specific concern you've heard about metformin, or maybe you've had a negative side effect personally from it, or you read something somewhere, or you know someone who has told you a story about how it affected them. I'm going to share a simple tip about how you can navigate that. But before we do that, thank you if you have subscribed. And if you haven't already, please go ahead, subscribe, share, and like, because that's how we get the word out. So what do I recommend if you have had a negative experience or if you've heard of a negative experience with metformin? I highly recommend that before making any decisions, go ahead and speak to your doctor. Okay, just find out the facts about the information surrounding it, share the information you learned, and make that decision with your doctor. Make sure you're making an evidence-based decision, not an emotional one, not one made from fear that could ultimately backfire or cause you to have regrets. I say this because I've seen it happen a few times, so I want to put it out there. I've had patients say that, man, I wish I had just taken the metformin early on so that I don't have to now do all these things that I have to do. Now I have pain. Now I have to see a cardiologist all this time. Now I have to, take insulin, because they ignored the diabetes early on when it was easily treated. So if you have valid concerns, your concerns are valid, but just sit down with your doctor, go through it, make sure that you understand, the evidence around it before making a decision not to treat, now when it's easy to treat. So I spoke about metformin today, but this is true for any medication you're taking. Don't stop medication without discussing with your doctor. A lot of times it often leads to complications down the line. If you don't like taking it, find a doctor that can help you reduce your dependence on medication and work with them closely. But don't try to do it on your own because a lot of times it ends up making things worse down the line. So I hope today you take a moment to make a decision about your health. Decide, do you need to check your blood sugar? Do you need to follow up with your doctor? Do you need to have this medication discussion? But regardless of what you do, don't delay your health. There's usually not a great time to address it. So just take the action now. And if you're in the Houston area, and if you have diabetes or any other conditions, and you're looking for a doctor who is proactive about your health, we're here for you here at InTouch Primary Care in Sugar Land. You can learn more about our services at our website, intouchprimarycare.com, or you can call us 713-280-9985. And we look forward to helping you on your journey to better health. So remember, diabetes is a serious condition. It can lead to many complications, but at the early stages, it can be so easily treated. So don't delay addressing it because the consequences it has when left untreated can be very serious. And by treating now, you'll be in much better shape. You feel better, you'll have more energy, you'll be more productive, you'll enjoy your life a lot more. So I hope that helps, and I will see you again next week.